Hi everyone, thanks for joining us today for this special NCCRED Clinical Research Scholarship webinar. We hope you're all staying safe and healthy during these unusual times. My name is Gemma Hallen. I'm the Project Officer for NCCRED, and I'm joined by Dr. Krista Seifried, NCCRED Clinical Research Lead and Deputy Director, and Annalise Stern, Research Associate and PhD candidate at National Drug Research Institute at Curtin University, NCCRED board member and chair of NCCRED Aboriginal Torres Strait Islander Working Group. So Annalie, I'll hand over to you now for the Acknowledgement of Country.
Thanks, Gemma. I would like to acknowledge that I'm on the land of the Whadjuk people of the Noongar Nation, and that both Gemma and Krista are on the lands of the Gadigal people of the Aurora Nation. I recognise the strength and resilience of our peoples who have maintained a continuing connection to the lands and waters of these regions, a right and a responsibility that was never ceded. I also acknowledge the traditional owners and caretakers of each of the nations that we are on today throughout Australia. I pay my respects to the elders, both past, present and emerging, and to the Aboriginal and Torres Strait Islander peoples that are here today.
Thanks, Annalie, and thanks again for joining us today. So before we dive into the discussion, I just want to remind everyone that if you have any questions as we go, you can use the Q&A button at the bottom of the screen and we'll get to them at the end of the webinar. So my first question is for Krista Seifried. Are you able to briefly give us a background to the scholarships program and maybe just outline what is considered a clinician and clinical research and how the program is structured and just some of the differences between last year's and this year's program?
So thanks, Gemma. Thanks, Annalie. Thanks, everybody, for joining us today. We're really excited about this program. This is the NCCRED Clinical Research Scholarship Program, and this is our first year of running such a program. I guess a bit of background, NCCRED, one of the key aims of NCCRED is to build research capacity in the clinical spaces. So really trying to build capacity in clinicians who work within the alcohol and other drug sector to conduct research and to feel more confident in consuming research, creating research and developing up the evidence base. Really just aiming to bring research closer to the front line, closer to the patient experience, and make it more informed by patient experiences. So part of that aim in this regard was to run some programs to help facilitate research in clinical spaces. So we've had some really great success with our clinical research capacity building grants and our clinical research seed funding grants and our clinical research fellowships program. So last year we appointed 3 clinical research fellows who are all currently conducting their research in WA, Victoria. And so this program really builds off of leveraging our experiences with the clinical research fellowships and the clinical research seed funding programs. And so for the first time, we're running it as a full scholarship program, which combines a salary buyback with project funds. And so our aim is to facilitate clinicians being able to conduct research in the clinical space without the pressures of having to continue with their clinical work. It really frees up the position to do the research and then provide some project funds so that the research can be implemented. One of the experiences we've had with our fellows and the shift is that the fellowships didn't include any substantial project funds, whereas this program does. And one of the experiences we had with the fellows was that program seemed to be a lot easier to settle into when there was an established idea or an established project that the fellow could leverage off of. And so this will hopefully facilitate that a little bit easier. So the clinician would receive a half-time buyback of their salary and be able to then conduct the research during that time. So in the organization of their choice, predominantly we found that that's the facility or organization where the person already is employed, and then they conduct research collaboratively with their team there. In terms of, Gemma, your question around what's a clinician and what is clinical research, we've got some definitions on our website. NCCRED takes the definition of clinician from the Institute of Health and Welfare, whereby a clinician is a practitioner who spends the majority of their time working, the majority of their working time engaged in clinical practice. So that's diagnosis, treatment, including recommending preventative actions, etc. And then in terms of clinical research, we actually take our definition from the National Health and Medical Research Council, the NHMRC, who describe clinical research pretty broadly, in fact, around a range of different health professionals studying a wide range of matters, including disease prevention, causation, diagnostic methods, treatments, and effects and responses to illness. So that research can occur in a variety of settings, including public or private, hospitals, clinics, inpatient, outpatient, other institutes and organizations. So it can be community-based, it can be primary care, it can be tertiary. It's really quite a broad definition. Again, those are on our website, and I think that they're part of the application packs. So I guess that kind of highlights where the program's at. It is a really generous program, so there are some really exciting opportunities available for clinicians. And then essentially, once you submit your application, that's actually reviewed by an external independent panel who assesses the application as per the application pack, which are both available to download on our website. And then that independent panel provides recommendations to the NCCRED Board of Directors in terms of who to fund for such a program. So hopefully that answers your questions, Gemma, but I'm happy to take more as people feel they have them.
Thanks, Krista. So my next question is for Annalie. We had a question come through during the week just asking why the different process for Aboriginal and Torres Strait Islander scholarship program and why they need to submit an EOI. So would you mind us going through the different process for that program and why the working group made that decision? Oh, sorry, Annalie, you're just on mute.
Sorry. Thanks, Gemma. Thanks, Krista. So basically, our working group is made up of Aboriginal drug and alcohol researchers and practitioners, not just those working in drug and alcohol, but there's also people working in Aboriginal health and the wider sector. And we've all been through the tertiary system in a lot of ways, but firstly, I'd just like to highlight that Aboriginal and Torres Strait Islander clinicians can also apply to the allied nursing and allied health round. So but we were, through our discussions, we wanted to make sure that we could support people best, in every way possible and not let people feel excluded and that it would be a daunting process. So, but also linked to that, the NCCRED board and NCCRED team have also acknowledged the importance of having Aboriginal and Torres Strait Islander research through NCCRED, and that it's important that it's actually led by Aboriginal and Torres Strait Islander people, because for too long we've actually had research that's been done about us but not led by us. So the working groups has suggested that one way to help support Aboriginal and Torres Strait Islander clinicians and drug and alcohol workers to lead research was supporting people throughout the process. So in CETA, one of our consortium partners, that in 2010 they did a study that showed that the majority of Aboriginal and Torres Strait Islander drug and alcohol workers have certificate level qualifications. So it would be actually negligent of us to not acknowledge this, because these people have so much knowledge and bring so much to the field that it's vital. But like I said, the university system and this proposed academia can actually be a really daunting thing. So we thought, how about we let people say, this is something I'm interested in, and then support them through actually developing up the proposal, refining a research question throughout the process. So so the expression of interest process will allow for people to be mentored and linked with mentors and others who actually have knowledge and skills in that topic that they're looking at. So this will help. So what will happen then? Yes, the expressions of interest will be reviewed, and those that are shortlisted will be mentored to develop a proposal that's also achievable within the time frame, because it is quite a short time frame. So we're not looking to fix world peace and all the drug and alcohol problems in the world. What we're doing is looking at something that can actually benefit clinical practice, and that's achievable within the time frame, given that we live in short funding cycles. So yes.
Great. And so I guess I can see that there's a question come through from Prakash. So thank you for sending that through. We'll get to that at the end. I've just got one more question for the both of you. How would you explain the best ways to develop your scholarship application? So how would you develop your research question and the project? How would you approach the experienced research partners? And even how do you approach the host site or your managers to develop the research proposal? And before you both start, you're both on mute.
I'll let you start, Krista.
Sure. I think it's important to talk to the people at your organization. You might find yourself in a space where you don't have a lot of research experienced folks around you to bounce ideas and assist you with your application. If that's the case, NCCRED has actually provided previously and is offering for this opportunity as well a mentorship linkage program whereby we speak to you, find out a bit more about your unique needs, about your area that you're looking to research, what you want to find out. So your research question, even if you haven't fully refined it, we can talk to you more about that. And then what we can do is we can actually link you with an academic who might be suitable to help you to form your application and develop that up a little bit, which is another thing with what Annalie mentioned about that mentorship in terms of the EOI process. So it's similar to that in terms of happening sort of through a formal linking program. Otherwise, if you find that if you are fortunate enough to have people around you who are research experienced, I would, take them the application form, show it to them, share with them what interests you about it. I do encourage you to talk to your managers because obviously it will be a half-time reduction in your position. So they would need to be aware to recruit to backfill your space, and just really having that open conversation so that they understand that we are going to be providing the funding to allow them to do that, because that is often one of the things that prohibits research, particularly in smaller organizations. It's one of the big things that can be sort of a bit of a barrier. And so to facilitate that, this is part of this program's aims. And so if you have that discussion a little bit earlier, it can be really useful. And then you might find that people who are around you who are senior researchers are often very willing to give a lot of their time to assist with this kind of development of a research proposal, and it's exciting. And I think in my experience, it's always exciting when people see that there is funding attached to it, because it actually makes it something that's going to be able to be implemented. It's achievable because there's that sort of tangible way forward. So, and then I guess just addressing the other part of your question, Gemma, there's lots of thoughts around things to try and organize yourself around ideas. And if you reach out to us, we can talk to you a bit more about how to generate those research questions and how to start sort of making your ideas a little bit more, application appropriate in terms of synthesizing what you want to do and distilling it into an application that'll be competitive.
Yeah, I agree with all of that, Krista. I think from my perspective, a lot of it is that research isn't actually a solo activity, even though you're doing it by yourself, that it's actually really good to bring a team around you and find those that people have similar interests, even if it's just someone to talk through your ideas. So you're not an island in the process, and contact, depending where you are, there's bound to be other researchers who might not actually be clinical researchers, but other researchers in your space, whether you're in a city, or if you're in a city, you could connect in with any of the other NCCRED staff and working group. I believe all our names are on the website, and I'm sure Gemma and the team can assist in linking you with linking people with those people. But also, research, you don't know everything, so it's around getting supports in those areas and just seeking throughout the process, seeking regular support. So, and the other point was, just when it comes to the question, don't go too big, focus on something that's actually achievable and definable within a particular time frame. So because life happens, as we've all experienced, that no one could have predicted what was going to happen this year, and how that's changed our way we operate and impacted. So we've all experienced some direct impacts to our research. That just requires adjusting. So.
Right. And so I'll just read out Prakash's question here. So it asks, would the program support qualitative studies exploring lived experiences of the clients regarding treatment or support services?
Absolutely. Absolutely. If you're a clinician working in this space and you have burning questions, and I think consumer involvement in research is imperative, and consumer-driven research is really important, and this is one way of finding out exactly and addressing those concerns. I just also wanted to just build on what Annalie had just mentioned, and just sort of reference, I think I might have made mention previously, but one of the things in terms of achieving some goals in the time frame, one of the things that we've seen some of the other previous fellows do is actually link their fellowship to a project that's either already been developed or already sort of underway, and then they do a sub-analysis or a sub-study in that project, and that can kind of be a way of getting like an automatic team around you, and ensuring that, because they've already started, in terms of being able to get some achievable outcomes. So that's another thought, and again, we're happy to talk about that and see what works best for your circumstances.
Thank you. And I guess just following on from that, if you're a nurse working in a hospital, for example, how would you know, or how would you get access to any of those studies if you're not exactly sure what's going on? How would anyone be able to access anything like that? Is it just a matter of reaching out to you, or I guess, yeah, if someone's not exactly sure, what would you advise about that?
So I can take that one. So I guess again, it comes down to speaking to your colleagues, finding out what's happening, talk to your clinical nurse consultants or your educators, talk to some of the senior staff members who are involved in research if it's happening. If it's not happening, talk to them anyway and find out maybe why it's not happening, or what might be the barriers that you should keep in mind when you're developing up your application. But I think certainly there's a lot of scope for finding out more if you just start sort of putting yourself out there. And it can be really daunting, but that would be my first suggestion if you're going to be around local.
Yeah, and if you're working, you're asking regarding a nurse in a hospital, but if you're working in more remote areas or drug and alcohol services, there's often a lot of services are doing quality assurance work or quality insurance processes, and some services, or the wider agencies, the peak bodies, have research people connected to them, and yeah, the NCCRED board has representation from those people, so we can, if we don't know, we can help connect as well, I think, in a lot of ways.
Yeah, and I agree, and reach out to us if you're struggling to sort of find those people, particularly, if you're working in a small NGO and research isn't sort of a common something that happens in sort of normal practice, and it's you know, harder to sort of infiltrate that research conversation. So if you like, we can assist with any of that, and possibly again linking you with others.
Great. And I just wanted to also touch base about why the targeted rounds. So we've touched on the Aboriginal and Torres Strait Islander program, but the general round is targeted towards allied health, although any clinician is able to apply. I just wanted to know why the targeted rounds, or wanted to let everyone know about the targeted rounds.
So I think we've had, as I mentioned, we've had some successful funding programs previously, and I think in this round we wanted to target people who might not have access to other research funding as readily, who might not have sort of structured programs around fellowships or scholarships, etc., that would give them that capacity to do research or participate in research at that level. And so it was felt that even though this is an audience that makes up, you know, a really large proportion of our workforce, it's not necessarily given the same opportunities as readily for things like research funding. And so trying to really encourage those candidates to come forward and to feel like this is something that's targeted and sort of pitched at that level, and just really create a program that addressed that sort of that need.
And I guess just leading on from that as well, just wanted to also let anyone know that anyone who is thinking of applying for the Aboriginal and Torres Strait Islander program, they can apply for both programs. So it's open for both. And I guess I just wanted to see if anyone had any more questions, or if Krista and Annalie, you wanted to add anything else.
I just wanted to make a mention, I guess, just for people who are watching. Thank you. Thanks for coming along and learning a bit more about the program. And if you found today that it's not the program for you, perhaps you could pass that information along to your colleagues, or perhaps you know somebody who it would be suitable for. But I also wanted to just mention that the Encrypt Symposium is coming up, and that symposium will feature presentations from previous NCRED fellows, as well as NCRED seed funding recipients. So that might just give you some ideas or some confidence, or it might, I think it's past the deadline for this program, but it just might be a little bit inspiring in terms of seeing what's happening and what these kind of programs can achieve.
Anything else? Okay. So I guess that's it from us. So if you have no more questions, I just want to thank Krista and Annalie for your time today, and thank you to those of you who joined us. We hope you found this helpful. And if you have any more questions, just feel free to contact us. You can email us or just go onto our website. And that's it. We hope you have a great weekend.
Thank you. Thanks, Gemma. Thanks, Annalie.
Thanks, everyone.
Good luck, everyone.